These risks isolating Uganda from global scientific community, accelerating the brain drain of our most highly skilled specialists like myself. If I decide to step and go to China, and I know that coming back is a problem, I might decide to remain there. Affecting Ugandan doctors who travel abroad for further studies, work, or medical practice and later return. They may be classified as foreigners, limiting them to temporary registration. Thank you very much. My name is Frank Robinda Simwe. I'm a consultant urologist and transplant surgeon in the Mulago National Referral Hospital. And I'm also the president of the Uganda Medical Association. This bill for us, it infringes on many things which affect our practice. The first thing is to classify and categorize people who are working abroad or training abroad as foreigners. That's very wrong. We're here trying to woo people who are out there, Ugandans who are out there to come back. But if now legally we classify them as foreigners, what is their chance of coming back? If they have got to go through several red steps to be recognized as Ugandans again. That's one of the problems it has. The second problem is the cap on the amount of money that can be received without getting clearance from the Ministry of Internal Affairs. They have capped it at 400 million. For an ordinary Ugandan, 400 million may look like a lot of money. But for healthcare, to put up a hospital, to equip a hospital, to respond to an emergency, to conduct research, it requires money in billions. And people have been receiving this kind of money and they've been doing a lot of work. So that cap is very low. And very many other things which are already being provided for. Taking away the responsibility of vetting the cost of equipment by the Ministry of Internal Affairs instead of National Drug Authority, National Medical Stores. All that is getting into work which is already being done by other authorities. So we are proposing that if we really need this bill, which we are doubting, then it must be amended significantly. They need to consult us further, take our thoughts which we have just submitted. We just submitted a 23-page document, and other stakeholders are submitting. There should be a wide consultation of all these stakeholders before this bill is put into effect. To safeguard Uganda from undue external influence, we contend that the bill in its current form possesses serious risks to healthcare delivery, public health security, medical research, and the ethical practice of medicine in Uganda.
Well, yeah.
I apologize. Please.
The one we have has
There are two documents.
PowerPoint presentation.
Let's begin with the document which has signatures at the front for the president, and that's not the one. If it doesn't have two signatures at the front, it's not the one.
We don't have it.
It is there. And actually, that's the one we shared online. That one you're holding, sir, is the one. Today we came with 20 copies, and we have submitted this same one online. I thought it was only in that route as the
you get some two copies for this member. Some of
Yeah, we brought 3 documents, but we've shared 2 documents.
Are you rolling more? But proceed.
Thank you very much.
Colleagues, just pay attention.
The object of the bill is to enact a law to provides for protection of the sovereignty of the people of Uganda, to designate the department responsible for peace and security as the authority in charge of registration and regulation of agents of foreign entities, to regulate foreign funding and assist to such agents, and to provide for related matters. Despite Uganda's efforts to uphold sovereign control, the current gap in specific sovereignty legislation has resulted in continued interference in government policies by foreign countries and their agents. We support the closing of this gap, but not at the expense of dismantling our health system. Healthcare is a constitutionally protected essential service and any legislation that directly or indirectly restricts access to health services, funding, or professional collaboration must meet the highest standards of necessity, proportionality, and clarity. Overview of the medical professions concerned. The proposed bill introduces broad definitions, discriminatory approval regimes, and criminal sanctions that are likely to adversely affect the health sector in the following ways. 1. Uganda's health sector dependence on international collaboration. Uganda's health sector system is heavily reliant on 1. International cooperation and research partnerships, 2. Humanitarian assistance and donor support, 3. External financing, which goes to over 40%, 4. Key partnerships, such as the recently signed $2.3 billion health financing pact with the United States of America targeting HIV and malaria. Critical global health partnerships. Medical practitioners working in institutions that receive foreign funding, for example, research grants from global health donors such as PEPFAR, the Global Fund, and WHO, may fall under the bill's definition of agents of a foreigner or recipients of foreign funding. Even when they are not directly soliciting such funds, this exposes health workers to potential criminal liability and severe penalties, Mr. Chairman. Number 3, introducing restricting vetting processes threatens to destabilize essential health financing agreements. 2, undermining capacity building efforts. 3, disrupt the training and technical assistance facilitated through global health leadership. And 4, violate regional protocols like those of the East African community. Key objectives to the bill. Key objections to the bill. 1, threat to healthcare financing and health delivery. Uganda's health system, as mentioned above, depends significantly on international health financing and research grants. 2, medical equipment and drug donations, critical for addressing stockouts, which is a big public cry in many facilities. 3, training and technical assistance facilitated through global health leadership and regional protocols. All those are being threatened by this bill. 2, the bill's requirements for prior approval, registration, and vetting of foreign linked funding. 1, it will delay procurement. 2, it might lead to suspension of donor funding. And 3, it might disrupt critical services such as HIV, TB, malaria immunization, and maternal health, primarily focusing on major international cooperation agencies. All these will be disrupted. 4.3, criminalization of legitimate medical practice. The bill expresses medical professionals. The bill exposes medical professionals and institutions to criminal liability for administrative or procedural non-compliance. This is deeply troubling because 1, there will be conflict in medical ethics. Professional ethics requires clinicians to prioritize patients' welfare and the do no harm principle above all. Forcing medical practitioners to wait for bureaucratic approvals before accepting life-saving aid or technical support creates an ethical dilemma that places patients at risk. 2, chilling effects on professional growth. The fear of severe criminal sanctions will discourage health professionals from engaging in legitimate international collaboration, including participation in global health networks, vital for responding to cross-border health threats like Ebola and COVID-19. 3, brain drain.
Please, Gilbert, charge me. I'm on low battery.
And researchers may avoid international training, fellowships, or collaborative research opportunities to avoid legal jeopardy. And this risks isolating Uganda from global scientific community, accelerating the brain drain of our most highly skilled specialists like myself. If I decide to step and go to China, and I know that coming back is a problem, I might decide to remain there. Affecting Ugandan doctors who travel abroad for further studies, work, or medical practice and later return. They may be classified as foreigners, limiting them to temporary registration. Disproportionate penalties. Criminal penalties for regulatory lapses are disproportionate. In a sector where time is often the difference between life and death, subjecting medical practitioners to the threat of imprisonment for procedural delays is incompatible with the practical reality of the medical profession. Number 4, chilling effect on medical research and innovation. Medical research is inherently collaborative and global. Progress in modern medicine relies on the free exchange of data, peer review across borders, and shared resources. The bill's broad and ambiguous definition of a foreign agent poses a significant threat by 1, capturing routine research partnerships. Many local health institutions, such as the Uganda Virus Research Institute, various universities, medical schools, operate through long-distance international grants. Many clinical trials and research projects funded by international donors have significantly contributed to the advancement of Uganda's health sector. Labeling these essential partners as foreign agents creates uncertainty, unnecessary stigma, and administrative hurdles. If you pick the document, I'm on page 10. Undermining institutional review processes. The proposed vetting layers risk bypassing or duplicating existing ethical oversight by the Uganda National Council of Science and Technology and the institutional review boards, leading to regulatory paralysis. Number 3, discouraging global clinical trials. By introducing discriminatory approval regimes, Uganda becomes a less attractive destination for global clinical trials. This deprives Ugandans of early access to cutting-edge treatments and vaccines for diseases like HIV, malaria, and Ebola. Number 4, long-term consequences.
Today, the Uganda Medical Association made a significant presentation before a joint sitting of the Parliamentary Committee on Defense and Internal Affairs and the Committee on Legal and Constitutional Affairs, addressing concerns over the proposed Protection of Sovereignty Bill 2026. In its submission, U.M.A. acknowledged the importance of safeguarding national sovereignty. However, the association strongly cautioned that, in its current form, the bill poses serious risks to Uganda's healthcare system. Key concerns raised included provisions that could restrict healthcare delivery, limit access to foreign funding, and introduce criminal penalties that may affect doctors and health institutions. U.M.A. emphasized that such measures could disrupt essential services, including HIV care, maternal health programs, and emergency response systems. The association further warned that clauses requiring government approval to provide health services could lead to delays in patient care, while restrictions on international collaboration may hinder medical research, innovation, and training. Importantly, U.M.A. highlighted potential constitutional concerns, noting that the bill may conflict with the right to life, the right to health, and the freedom of medical professionals to practice. The association called upon Parliament to either reject or substantially amend the bill, proposing clear exemptions for healthcare services, research, and emergency response activities. This presentation marks a critical moment in the ongoing national conversation as stakeholders weigh the balance between protecting sovereignty and ensuring uninterrupted healthcare delivery for all Ugandans.
Require immediate and decisive action. Uganda's acclaimed response to outbreaks such as Ebola, Marburg, and COVID-19 have historically depended on 1, rapid cross-border cooperation, 2, immediate funding disbursement, 3, swift deployment of international expertise. These will be put in jeopardy. Fatal delays. Subjecting these critical responses to prior political or administrative approval processes may cause fatal delays in fatal delays. In the context of an epidemic, a delay of even a few days can lead to exponential spread. Health emergencies do not wait for regulatory clearance. Violation of constitutional and professional freedoms. The bill in its current state appears to infringe upon the fundamental rights enshrined in the Constitution of the Republic of Uganda, and specifically, freedom of profession, that is Article 40, freedom of association, Article 29, academic and scientific inquiry, and the right to health. Professional independence. Healthcare professionals must remain professionally independent and ethically neutral, forcing clinicians to serve as extensions of state security or administrative vetting apparatuses undermine the scarce trust between the doctor and their patients, especially in sensitive humanitarian contexts. Allow me to skip and go to page 15, in the interest of time section. Legal and constitutional framework. The concerns raised by the medical fraternity are firmly grounded in Uganda's constitution and existing health laws, which collectively impose positive obligations on the state to protect the health service, medical professionals, and the public health system. 1. Constitutional guarantees. Rights to health and state obligation. The Constitution of the Republic of Uganda places an affirmative duty on the state to safeguard the public health. 1. National objectives and directives, the directive principles of the state policy, objective number 14, and then objective number 20. Rights to life. Article 22(1) guarantees the right to life. Courts have consistently interpreted this right to include access to essential health care, especially where state action or inaction foreseeably leads to loss of life. Number 3, freedom of profession and association, Articles 29(1)(e) and Articles 42. Limitation of rights test, Article 43. And then potential amendments that may be required if this bill is enacted into an act. If enacted in its current form, the bill may necessitate.
Ekisooka egamba nti singa ogenda wabweru otandika okukolera wabweru oba ofuuse foreigner, tumanyi trainings ezisinga naddala nnyo eza specialization tuzikolera wabweru. Kitegeeza bw'oba osomesa agenze wabweru oba Kenya oba Bungereza oba India kusoma oba ofuuse mugwira, kitegeeza bw'oba okomawo ojja kufuna obuzibu. Ekyo si kirungi. Ekyokubiri egamba nti singa oba ofuna ssente eziyise ku miliyoni 4, ku Munnayuganda atulira miliyoni 4 zisobola okuwulika nga ssente nnyingi, naye ku bye tukola ssente si ze nnyingi. Olina okugenda wa Minister of Defence, Minister of Internal Affairs, n'ofuna olukusa okufuna ssente. Kikumpana naffe. Bw'oba oyagala kuyingiza ekyuma ofunye abantu abayingiza tugambe MRI, CT scan, ng'ebyo olina okufuna olukusa. So it will slow down. Katugambe tufunye pandemic nga Ebola bwe yajja oba kolera, ofunye amawanga gazze gabayitibwa okuyamba, olina okusooka okufuna olukusa. So and yet waliwo amateeka agakola ku bintu ebyo ebisinga. So tugamba nti etteeka lino materinaba kufuna bwongere otwebuuzaako n'okugonzako obukwakuzi singa eryo etteeka liba lyetaagisa anyway, kubanga lirabika amateeka mangi agakola nabyo byerigenda okukola.